Will this discharge petition be the answer?
Look, I'm not sure. I'm not sure that it can get the 218 signatures to get a House floor vote, especially now that the Democrats have introduced a simple one-year extension without any fraud prevention measures. Our solution is truly the best way to go about this. We have Republicans and Democrats. There's 8 of us that have introduced a solution here. We are members of the Problem Solvers Caucus. This is the very reason why our caucus exists, to try to put forward some type of compromise. What our legislation does, it allows for an extension of the subsidies, but in a way where we are not only preventing this spike in premiums that consumers and patients are trying to avoid right now, but it also goes after some of the fraud by putting in specific measures that rein in the insurance companies and the brokers and how they enroll individuals to ensure that we're not giving subsidies for people that don't even exist or are dead, or the Social Security numbers that are being used to enroll thousands of people. It's the best solution I see, based on everything that I've heard here in Capitol Hill, that really truly brings both parties together. But people have to be willing to give a little and sign on to our legislation for us to be able to move it forward and convince leadership.
What's the speaker saying about this? Anything, Congresswoman? Is there a chance that this doesn't have to be a discharge petition? He might even bring it to the floor?
Unfortunately, the Speaker says he does not want to do an extension of the Affordable Care Act subsidies. Now, look, I recognize what my colleagues are saying here. It is true. The Affordable Care Act was never truly affordable. That is how we got in this mess. Democrats sold the American people a bill of goods in 2014. But here we are, and we have to address this issue to prevent this spike in premiums. What our bill does, what's really important here, is that we go after the fraud, and that is the part. 11 million people are enrolled in this program that never even used it. And there are millions of people that also have been enrolled that we believe could be potentially fraudulent. We saw tens of thousands of people being enrolled under the same Social Security number, or their Social Security number matched somebody who's dead under Social Security rolls. So there's so much fraud here, which is why we think we have the proper balance. And this gives us enough time, by the way, to then work over the next year or two to be able to come up with something that can truly replace the Affordable Care Act and bring costs down. Now, what the Speaker and leadership are saying is that we're going to take up a health savings account measure, which will help people certainly with their medical costs, and I support that initiative. But it doesn't go far enough. And what they also want to do is something else that will drive down premiums by 12%. I support both those measures, but I still think our solution, coupled with, by the way, the opportunity for Americans to have 50% of their premiums put, 50% of this tax credit put in a health savings account that they can use toward the payment of their premiums, which they cannot do now. Health savings accounts cannot be used for those premiums. That goes a long way. And we also have the PBM reform in there as well. Preventing spread pricing that will drive down prescription drug costs. So we think we have a very good comprehensive plan.
That's what I wanted to ask you about. I thought cracking down on PBMs was one of the only bipartisan activities on Capitol Hill these days. You're not getting more love for that? I'm amazed that these numbers are not higher.
Well, I think you have a very large group of angry members, both Republicans and Democrats, if we do not pass PBM reform. They are the middlemen, right? And they're also not just the PBM. Oftentimes, they are the insurance company and they're the pharmacy. So, you know, this vertical integration is not good for the consumer. It is not good for our small mom and pop pharmacies. They're dictating what their competitors are making. If they're let's say a CVS, for example, they're dictating what their competitors, small mom and pop, are getting reimbursed for prescription drugs. They're dictating which prescriptions are covered by the plans and what consumers are paying. And there's no transparency. It is wrong, and it has to end. That is the #1 thing that can drive down prescription costs in this country.
How about that?
And in the past, President Trump has been very supportive of that. And he's kind of signed that he was, he signaled that he was supportive of some type of extension with reforms to tackle the fraud for the insurance company. So we're hoping we can get to a resolution here. But you know, remember, this was a problem that was dumped on Republicans' laps, right? We're trying to do the best we can with what we can do right now, because the Democrats set the expiration date for these subsidies. They set it to expire now, and so we're trying to do what we can and come up with the best policy to move this forward to protect our constituents and the taxpayer.
You mentioned disappointed members, and I keep hearing stories, if not direct accounts here on our air about members who are disappointed with the Speaker of the House right now. In many cases, female members like Nancy Mace, Marjorie Taylor Greene, who say they don't even want to stay around anymore with the way that he's running things. And President Trump came to his defense. Obviously, Mike Johnson has one of the hardest jobs in the world. I think we can all agree on that. The question is whether he's effective right now. Congresswoman, here's what Donald Trump thinks.
I think Mike Johnson is great. You know, he's had a majority of 2, 3, 4, then back to 2. We actually had 1. So we were 1 heart attack away from disaster. So everybody prayed for everybody's health. I think Mike Johnson's been a fantastic speaker. I mean, a very hard job because, you know, when you have a small majority. I think Mike Johnson's been a great speaker. I think few people could have done that job.
Does the Speaker deserve the criticism that he's been getting from various quarters, Congresswoman? And do you feel heard as a female member?
Well, first I'll say that he does have a very difficult job, and you do have a very slim majority. So we've been able to get a lot done. We've delivered historic tax relief for middle-class families, for working Americans, for senior citizens, for businesses. I think we're going to see the economy do extraordinarily well in 2026 because of the measures we were able to pass this year. And we've been able to do a lot of good things. The problem is, I think there's a frustration from rank-and-file members, particularly because now we're at the end of the year, with some of our own legislative priorities that could be considered non-controversial, doesn't cost money. We're having trouble navigating these things out of the committee and onto the floor. We think we should be churning out more member priorities, and I think that's where the frustration lies. I have some of those priorities. I did get a lot done this year with the SALT relief I delivered for New York, as well as the bonus deduction for senior citizens, the 100% manufacturing expensing for new facilities and expansion of facilities. Those were all my priorities that got into that big, beautiful bill, and I'm happy about that. However, I do have some smaller things that we would like to see get out of the committee and onto the floor. And if leadership could help us with that, I think you'd make a lot of members happy.